The components of the adult ankle rules are pain at the ankle or foot and inability to weight bear 4 steps immediately after the injury or in the ER, or bone tenderness at the 5th metatarsal or the navicular, and bone tenderness at the distal posterior 6 centimeters of the tibia fibula. Test sound cluster for rotator cuff tear. The drop arm sign. This test is positive if the patient cannot descend from the full range of motion in a smooth fashion. The painful arc sign. This test is positive if the patient complains of pain between 60 and 120 degrees. And the infraspinatus muscle test. This test is positive if the patient cannot maintain this position or if they cannot resist a medial force. Test sound cluster for subacromial impingement consists of the Hawkins-Kennedy test. This is positive if the patient reports pain deep in the shoulder. The painful arc sign. This test is positive if the patient has pain from 60 to 120 degrees. And the infraspinatus muscle test. This test is positive if the patient cannot hold this position when given a medial external force. The test sound cluster for spinal manipulation includes no pain distal to the knee, the duration of symptoms lasting less than or equal to 16 days, FABQ score is less than or equal to 18, at least one hypomobile segment, and one hip at least 35 degrees internal rotation. Test item cluster for spinal stabilization is the patient is younger than 40 years of age. The patient has an average straight leg raise of greater than 91 degrees. The patient has a positive prone instability test. So I'm going to have the patient lying prone. I'm going to look for a painful segment. And I'll find a painful segment and have the patient stand on the edge of the table. This test is positive when I press on the patient's spine and the pain is reduced. And the last item of the test sound cluster is aberrant motion. The test sound cluster for cervical radiculopathy, the positive Sperling's test. So this is positive when there's an increase in perforization of symptoms. Distraction test. This is positive if the patient experiences a decrease in symptoms. The upper limb tension test. The upper limb tension test is positive if the patient has a recreation of symptoms, and also if the patient bends her head ipsilaterally, symptoms get better, and the patient bends contralaterally and the symptoms get worse. And the last item is less than 60 degrees of ipsilateral rotation of the cervical spine. Test item cluster for mechanical neck pain that benefits from thoracic manipulation includes symptoms less than 30 days, no pain distal to the shoulder, looking up does not aggravate the symptoms, FABQ score less than 12, the patient has diminished T-spine kyphosis, and cervical extension range of motion is less than 30 degrees. Lastly is a test for meniscal pathology. The patient stands on a symptomatic leg, bends their knee to around 20 degrees, and they rotate on that knee 3 times to either side, and test is positive if this test recreates the patient's pain or if the patient is feeling giving way. The Lockman's test for ACL incompetency. This test is positive if there is a laxity in the ACL or there is excessive tibial translation. upper limb tension test of the radial nerve. This test is positive if it recreates the patient's symptoms. The valgus varus stress test of the elbow. The test is positive if the patient feels any ligamentous laxity on the medial or lateral aspect of the elbow. The active compression test tests for the bicep labrum tear or AC joint lesions. The test is positive if the patient has pain when you push down on the arms like this, and the pain decreases or is eliminated in this position, and the pain is either in the bicep, deep in the shoulder, or at the AC joint. Sperling's test is positive if it reproduces the patient's symptoms.
I think those are only like 1 gigabyte.
Faber test. This test is positive if it reproduces the patient's pain in the hip or the SI joint. Keynesian test. The test is positive if it reproduces the patient's pain in their lower back. Differential diagnosis of a rotator cuff tear versus a C5 radiculopathy. Rotator cuff tear, person will have atrophy of the muscles or thinning of the muscles, and also they would test positive in a test sound cluster for rotator cuff tear, which is drop arm sign, a positive drop arm sign, a positive painful arc, and a positive infraspinatus muscle test. A person with a C5 radiculopathy will have diminished reflexes. Their sensation will be lost on a dermatome. They will have myotomal changes, and their pain will be radiating down through their shoulders and their arms.